Struggling to remember Andrew's 6 keys to normal occlusion? Don't worry, by the end of this video, you will not only remember them, but actually understand them clearly. Hello and welcome to Dental Notebook. In this video, we will simplify each key in the simplest way possible. So let's study them in detail. So, Andrew in the year 1970 studied in the model of 120 patients. And these 120 patients were not a random patients. They were not a random patients. They were only those patients who have ideal occlusion. So these patients have ideal occlusion. You can see? So only those patients who had an ideal occlusion, Andrew studies the model of such patients and found out that there should be the need of the presence of certain features to achieve a normal occlusion. So he considered the presence of certain features that are essential to achieve normal occlusions and thus founded the 6 keys to normal occlusion. So let's study them in details. So the first one is your molar interarch relationship. The second one is your mesiodistal crown angulation. Next is your labiolingual crown inclination. Fourth is your absence of any kind of rotation. The fifth, there should be tight contacts between the teeth. And the sixth one is the curve of Spee. So these were the 6 keys to normal occlusion. These features should be present in all those patients who want to have an ideal occlusion. So the first one is your molar interarch relationship. So let's see, interarch means in between the upper and lower arch. The relationship of the molar teeth is going to decide the Andrew's first key to normal occlusions. So there would be 2 considerations which we are taking. So the first one is for your first molar, alright. So here we are considering the first molar. One would be in your upper arch, the other one is going to be in your lower arch. So for the upper arch, the mesiobuccal cusp of the upper first molar should occlude in the buccal groove of the mandibular first molar. So let's see it with a diagram over here, alright. So here you can see that this is your upper molar, okay, upper first molar, that is 6, and this is your lower first molar, that is your lower 6. So you see, when we are dividing this tooth into the 2 sections, one which is towards the midline is called mesial and the one which is away from the midline is called distal. So this part is mesial and this part is distal. Now here it is considering you to say that the buccal cusp, the buccal which is facing towards the cheek area. So this is your buccal cusp. So the mesiobuccal cusp. So what is the mesiobuccal cusp? The one which lies on the buccal and mesial side, that cusp is called as your mesiobuccal cusp. Alright. So this tip is your cusp. This cuspal tip is your mesiobuccal cuspal tip. So how it should occlude? It should occlude in such a way that when it comes into the occlusion, it should occlude in the buccal groove of the mandibular first molar. So after occlusion, this is what it will look like. The mesiobuccal cusp is going to occlude in your buccal groove. So this is what the final occlusion should look like for the ideal occlusion. So this was the Andrew's first key to normal occlusion. In this, there is a second part as well. So for the second consideration of the molar relationship of the upper and lower arch, it has stated that the crown of the upper first molar, should be angulated. Okay, the crown of the upper first molar should be angulated in such a way that the distal marginal ridge of the upper first molar should occlude with the mesial marginal ridge of the lower second molar. So here what is the relationship is coming? In the first one, the relationship was coming between the first molar only of the upper and lower arch, but in this case, the relationship is going to come between the upper first molar and the lower second molar. And in this, the cusp was occluding with the groove, but in this consideration, the ridges will be in relation to each other. So for the upper teeth, the upper first molar, distal marginal ridge, and for the lower second molar, the mesial marginal ridge should occlude. So let's see it with a diagram. So in this image, you can see this is your upper first molar. Okay, this is your lower second molar. So in this interarch molar relationship, we are going to see the relationship between the upper 6 and lower 7. So here we have already studied that the one which is towards the midline is mesial, and one which is away from the midline is distal. So here it has said that the distal marginal ridge, so this red mark is your distal marginal ridge, all right. And the same here is considered for the lower 7 molar. Here you can see, if we will make a midline from here, the one which is towards the midline is the mesial side, and one which is away from the midline is the distal side. So for the lower second molar, we have to consider our mesial marginal ridge. So this is going to be the mesial marginal ridge, and for the upper, this is going to be the distal marginal ridge. So it has been stated that the angulation, the upper first molar should be angulated in such a way that its distal marginal ridge should come in occlusion to the mesial marginal ridge of the mandibular second molar when they are in normal occlusion. So you can see, when the upper and lower teeth come in occlusion to each other, you will find out that the distal marginal ridge will occlude with the mesial marginal ridge over here. So the distal marginal ridge of the upper first molar will occlude with the mesial marginal ridge of the lower second molar. And the condition of the first, here you can see that with this you will find out the mesiobuccal cusp, this is your mesiobuccal cusp, will occlude with your buccal groove of the lower first molar. So both the condition over here, the mesiobuccal cusp of the upper first molar will occlude with the buccal groove of the lower first molar, and it should be angulated in such a way that the distal marginal ridge will occlude with the mesial marginal ridge of the lower molar. So this was your molar interarch relationship. Okay. So in this image, you can see both the point we are going to take in the consideration. The first one here, you can see this is your mesiobuccal cusp of the upper first molar, which is going to occlude into the buccal groove here in the lower first molar, all right. And the second consideration which he was taking, that the teeth should be angulated in such a way that the distal marginal ridge of the upper first molar will occlude with the mesial marginal ridge of the lower second molar, all right. Here you can see this is your second molar, which is your number 7, and this is your upper first molar, which is number 6. So its distal marginal ridge will lap with your mesial marginal ridge of the lower second molar. So both of this image and this image, you can see how this Andrews keys to normal occlusion is coming to the point in this ideal occlusion. Now coming next is your mesio-distal crown angulation. So you can see, suppose this is your crown portion, okay. This one is your mesial side, this one is your distal side. Mesial means towards the center. Suppose we are considering this teeth over here. So this is its mesial side, this is its distal side. Now what it states that this upper surface, this is your gingival part, and the lower one, which is at the edge, it is called as your incisal part or your occlusal part, all right. So it states that it should never be in at 90 degree to each other, all right. These two should never be 90 degree to each other for an ideal occlusion. There should be slight angulation. The crown should be slightly angulated more towards the distal side, not towards the mesial side. It should be angulated more towards the distal side. So here in this image, you can see this is your crown section. You can see that this is the incisal edge, this is the incisal part, and this one is your gingival part. Let me mark here it for you. This is your gingival part, okay. This is your gingival part, and over here this one is your incisal part. So here you can see there is a slight crown angulation. So here you can see that mesiodistally the crown is slightly angulated. This is your mesial side, so this is your mesial section, and this is your distal section, all right. So what does the mesiodistal crown angulation states that? So it states that the gingival part of the long axis of the crown should be distal to the occlusal or incisal part of the long axis. So here in this image, you can see this is your incisal edge, okay, and this is your 90 degree angulation to the long axis of the tooth. But this is not an ideal occlusion. There should be a slightly tilt suppose this is your mesial side and this is your distal side. So the crown should be angulated mesiodistally in such a way that the gingival portion will come towards the distal side of the long axis of the tooth. So here in this image you can see that here right now it is at 90° to the long axis of the tooth. But here, according to the ideal occlusion, the tooth should be slightly angulated. The mesiodistal crown should be slightly angulated towards the distal side in such a way that the gingival portion should lies on the distal side of the occlusal or incisal part of the long axis. So here you can see this is slightly distal to it. So in this image you can see over here, this is your crown. This is the gingival part which is slightly distal to the long axis of the incisal part. So let us make more clear. This is your incisal or occlusal plane. This is your 90° angulation, but the crown, there should be a mesiodistal crown inclination in such a way that it is slightly bended towards the distal segment. So this should be the ideal occlusion. This will be your incisal part, and here it should be the gingival part of the long axis of the tooth. So this is the incisal surface, and slightly towards the distal surface there should be the gingival part of the long axis of the crown. Okay, now moving to the next one, which is labiolingual crown inclination.